Thank you, Mr. Speaker. I want to take this opportunity to thank our frontline health workers for the commendable job they have done. These are the people who sacrifice their life for the well-being of our sick patients. Mr. Speaker, two weeks ago, I went to Kiambu Hospital, Kiambu Law Court over a certain issue, and then the court is adjacent to the hospital. So I called a colleague of mine to find out how they are faring. In terms of preparations, I want to state that we are far much ahead of those guys. Mr. Speaker, Kiambu being a stone throw from Afi House and where Mutai Kagwe was. On the issue of masks, there are some masks which are recommended against this disease. The like of Honorable Huska, what he's wearing is just protecting against dust. So there is even written, it's not for medical use. There's somewhere written on his mask, especially those with those masks. Kindly, the recommended masks are surgical masks, like the one of Jacob and the one you have. So the rest are just footwears and bra. Some of them people, especially those who are putting cloth. Those masks have pores which can allow the virus to penetrate, to pass through. So you are not protecting yourself and you're not protecting others. Mr. Speaker, back 2014, after 2014, there was a time 8 ambassadors converged in Mandera over issue of maternal mortality rates. And there was a research which was done by DANIDA and UNICEF. So that time, because of this border, we are bordering two countries with poor healthcare system. So in that report, they said if there is an outbreak of contagious disease like Ebola, Corona, or other diseases, Mandera, in terms of isolations, one bed will be shared by 10,000 people. So those people, when that report was passed to the health department in 2014, is just telling them to be proactive so that at least they should have an isolation ward in every sub-counties. Now that for Mandera, we have an isolation ward, I think our health department will take it up with the department and also the executive so that at least all the 6 sub-counties should have isolation ward for other pandemic. Today we are talking of COVID-19. God knows, God forbid, after 10 years from now, we'll be talking of Wario 19 or Wario 2020, another pandemic. So at least now, this pandemic has triggered the system so that at least we'll be prepared for something that will going to happen in future. I think we'll take up at least so that at least we have an isolation wall in every sub-counties. This pandemic has disrupted a lot of services, especially when the first case was reported in Mandera. All the routine services like immunization has gone down, ANC visit has gone down. People even fear taking their kids to the hospital for immunizations or other follow-up. It has also disrupted the livelihood of people who are, some of the companies or business owners have made their employees redundant. And these people, it has brought a lot of havoc. In terms of mass testing, I think we'll do away with mass testing because if we do mass testing and find out 80% or 10% of the population is positive, we don't have where to take them, where to isolate or quarantine. We'll only concentrate on the 5% who present with critical severe symptoms because 85% of this COVID are usually asymptomatic. Asymptomatic means you don't present with any symptoms, 85%. 15%, 10% present with symptoms like fever, headache, and other things. But there are 5% which usually proceed with severe symptoms and which need hospitalization, oxygen supplement, and ICU. So because doing mass testing, we just create anxiety among the public. So we'll concentrate on that. Now that we are prepared, we have an ICU. In terms of oxygen supply, There was a time in the social media that one of the frontline health workers in Wajir has died because of oxygen. And then there's an MP, Mutunga MP, he died of oxygen. The first institution which he was rushed to, he was referred because there was no oxygen. In Mandera, in terms of oxygen, the first visit we made to these hospitals, one of the recommendations we made, we should have an oxygen plant. There are 2 oxygen plants which was bought by the county back 2018. One was installed in Mandera and one was installed in Elwak. That oxygen plant, we can manufacture our own oxygen, so we don't need to ferry cylinders from Nairobi as it has been before. So in terms of oxygen, unless those machines become faulty, in terms of oxygen, we are okay. If you go to theater, there's a container behind it, that's the oxygen plant. We can manufacture our own oxygen and even can supply the neighboring county. On issue raised by Honorable member representing Guticha, why there is no medical officer in Lafe and Banisa. Last year, there are those two institutions, there is a medical officer, but those guys have been released for studies to do their postgraduate. So now that the theater is being opened in Lafe and Banisa, by January we'll be, as a committee, on behalf of Health Service Committee, we'll seek an audience with the department so that at least we don't have shortage of MO. Banisa and Banisa and Lafe will have, if not 3, we'll get 2 MOH, medical officer. Mr. Speaker, when we passed the health service bill, one of the critical concerns we wanted to put in that bill is that revenue generated by hospitals should be retained by hospitals so that they defray the cost and other expenses. The electricity is talking about when there is a delay in disbursement of funds from the national treasury to the counties, most of the services at sub-counties are paralyzed. Now that there is a directive by Ministry of Health that every county, through the Council of Governors, that every county should pass legislations. There was a bill to be developed, county health management hospital funds. I think that thing has been, that directive was issued last week to all 47 sub-counties, 47 counties, so that at least whatever generated can be used at the sources so that at least they pay subordinate staff, they pay electricity so that there will be no service disruptions. Mr. Speaker, with those few remarks, I stand to support the committee recommendations. And now that this COVID Adhoc committee has come to a dead end, Health Service Committee are ready to take up from there with your direction. Thank you.